Okay.
Okay, moving on to the Kennedy Cluster project. There's an information provided about the fiscal year 14 budget on page 14 of your packet. There's funding for the Kennedy Cluster project in several areas. The first, there's $75,220 in the Department of Health and Human Services budget for a program manager, and the person is really entitled the Kennedy Cluster Care Coordinator. And that person does coordination of services for families with school-age children who are facing different problems and are identified by the project. In addition, there's funding recommended by the executive, new funding of $80,000. It's recommended to engage a Kennedy Cluster out-of-school time consultant. It's listed incorrectly as a coordinator, but that person will have two roles. The first one listed is assisting in developing a plan to expand the Kennedy Cluster project to other clusters, explore the broader impact of the work across the school system, developing a logic model, identifying key interventions, and developing a method for funding the project as it expands. There's also funding to develop a model to expand the Excel Beyond the Bell program to other middle schools and execute an MOU that mirrors some of the Kennedy Cluster MOU components. And did you want to talk? Or okay.
Well, I know there's a lot of interest in this item. Why don't we go through everything the executive is proposing?
That's actually it from the executive, but MCPS also has in their operating budget, $29,093 for the MCPS Kennedy Cluster Project Coordinator.
Okay, so if I may ask the first question, where is the evidence of academic improvement from all of this effort? The school system is asserting that there's been academic improvement. Do we have data?
We have a small sample. There's a fair amount of material provided within the packet showing.
Where in the packet?
Begins on circle 51. Oh no, circles 52 through 62, where we talk about the gains that have been made by the children and the families who've been involved in the project.
All right, I'm sorry, I didn't read all 10 pages. Can you direct me to where the data are on academic improvement as a result of this?
I think the most important, and I guess I can just walk through it, and I think we've pointed out this in the past, that we have a small sample that we're dealing with. But if you look at 57,
58, 59, 60.
Yeah.
59 and 60 have numbers, 57 and 58 have more of a narrative.
But what we have had reported back by the administration of the respective schools and the counselors, that we have increased attendance by the students who are involved, reduction in disciplinary referrals, and improvements in grades. And as I think we talked about last year, we cannot demonstrate huge gains within their school performance, but we do assert that the youth who are coming, the families who are coming to the Kennedy Cluster, could potentially have suffered much more difficult situations, withdrawal, and also a drop in their grades.
This seems like a very soft evaluation to me. I'm not.
Oh, it is. It is.
Uh-huh.
Just to be clear, there isn't any funding. This is a very bare bones project. When the original vision was for Kennedy.
But you have a universe of children
Very
who
expensive.
have been in the program or who are affected by the interaction among the agencies, and of those children, is it possible to measure their test scores or academic performance in some other way?
What we do look at are the indices that prepare them for school success. And so they are attending, there is increase in school connectedness. In addition, we do have Dr. Claire Keller, who's working with us on an assessment evaluation. It will be qualitative again, but it is looking at those concepts. So the Gallup study that was done with the school system, looking at hope, engagement, well-being, all of these things, these elements.
I'm just joking.
But these are things that help students be attached to their school, to feel, and it is documented that hope is actually a better predictive academic achievement than other measures.
I really don't get this hope thing.
Councilmember Urban.
Let me just, I think that the Councilmember Leventhal actually asked the question, because I authored, along with Council President Navarro in 2007, the Kennedy Cluster Project, and And the former superintendent, Jerry Wiest, and all of us, our idea about the Kennedy Cluster Project was how to do you quantitatively measure closing of the gap through, inside the classroom measures. Now, this is, as Councilmember Leventhal indicated, was a soft evaluation, but that's what you get when you don't fund the project. The project had no money to do any real qualitative and quantitative analysis. So, moving forward, I know that Council President and I met with Chuck Short from the county executive staff. We met separately, and he sort of laid out what he would like to see moving forward. But based on what Ms. Yao has provided for us in this packet, I am very skeptical about moving forward with the Kennedy Cluster Project if we're not going to fund it in a way that makes sense for us to fund it, because we're going to continue to come back to this panel year after year with soft evaluations that don't tell us much about anything except some hope indices. I don't know what that means, but how you're measuring hope. But anyway, I know that's the superintendent's thing. But anyway, I think that Chuck Short does have a really good way to look at this. He believes that we should fund a project for real, and not with $80,000 for a consultant, and not with $29,000 for some project coordinator that you can't really make anything happen. So the whole purpose of the Kennedy Cluster Project was to try to measure how to close the achievement gap outside of school, and then see how inside the classroom that actually had impact. We're not able to do that yet. I think there are well-meaning people that want to do the right thing here, and that we could fund a project that really means something for the children and their families and the community and the schools around it. So, so it's 5 years later, and we're still not, we have not established a funding stream that makes sense. We're grappling with the achievement gap inside of school, and certainly all of this out-of-school time that we're hearing about, Excel Beyond the Bell, linkages to learning, pre-K services, the list goes on, and as Councilmember Leventhal pointed out earlier, none of this goes underneath the umbrella of the maintenance of effort, which is where it really belongs, because it's all supporting children. So that's all I have to say. There's no point here other than we're just like dropping pennies in a bowl and hoping that that's going to matter. It's not going to matter.
I'm just thinking here, if we were going to seek any revisions to maintenance of effort, whether the spending that is, this could not be more directly linked to academic achievement. This is all about academic achievement. So if we're, maybe in some session of the legislature, if we could hive off some of the things that we do that are directly connected to academic achievement and include those as our contribution to maintenance of effort, that might be an amendment worth seeking.
Absolutely, but we need the qualitative and quantitative analysis to make the
show that it
points.
works.
We have to show that it works.
I'll yield. Yes, sir, Council President.
Thank you. Certainly, the thought behind this project in 2007 was almost as if we were predicting what was coming to us, because the idea was to bring together all the agencies and then work towards this one specific goal, reducing the academic achievement gap of African American students, because this cohort group was the one that was not doing as well when you looked at all of the data. But the purpose of it was that after we worked out the implementation piece, right, it was going to be then replicated in other areas of the county. It wasn't just to stay there in the Kennedy cluster forever, but that we would control for language and culture, and it would just apply to the Latino community as well. And the idea is that this would provide a blueprint so that we would know where to make our strategic investments. And yes, I mean, I wish we had been able to get to that point, because it would have been very useful. And it would be useful right now as we're having all these conversations about how do you close the academic achievement gap at a time when resources are scarce. This was to be the blueprint. And it's very exciting and extraordinary because, I mean, something similar was done, you know, in Harlem with the Harlem Children's Zone. I mean, it was supposed to be modeled roughly after that. So I have the same questions. I understand we got hit by the recession, and I applaud the fact that some of the services were, you know, continued with very little resources. But we do have to make a decision. I mean, if we believe, and if all these conversations we just had about, you know, scratching our heads about, okay, which linkages to learning goes where, and how much do we invest in early childhood, and all of those things, I think, are part of this particular model. That we should be able to have a blueprint that says, yes, you know, we know that if you place this and this and this investment, and you do this inside the classroom, this yields X, Y, or Z reduction on, you know, particular criteria and particular measures. And so I feel the same way. I feel that, you know, fine, if we're going to invest this, and I wanted to look at ways that we could expand this because I was excited, but then when I looked at it, I'm thinking, so maybe the focus needs to be developing that particular action plan that says, this is where we're going, you know, this is how we're going to wrap up the Kennedy cluster focus, because I remember we had short-term, mid-term, and long-term goals. We had the low-hanging fruit, and then we had, I remember, like, just to learning was one of the big ticket items that we thought, yeah, we need to, pre-K was, you know, so we have a lot of work that's already been done, and oh, by the way, you know, the Latino Youth Collaborative could have just, you know, saved a lot of time meeting and spending so much time with staff. I mean, I think it was a great, you know, effort, but it's the same thing. At the end of the day, it's the same strategies that we're looking at. We're going to have to control for language and culture. So, you know, I guess I just feel like if that's what we're going to do, great. And if we're, you know, all in this together, then let's find the funding source, as Councilmember Irvin was saying. Let's just go ahead and do this thing versus pretending that we're doing something wonderful and patting ourselves in the back. You know, this is just, you know, in paper saying that, oh, we're going to now expand the Kennedy Cluster Project. This is not what it was intended for. So I would be, you know, more inclined to supporting this if that's what we were going to do, and if next year then there's going to be something that comes forward where we say, with the school system as full partners, and really like Councilmember Leventhal's suggestion, I mean, we have not ever had a conversation about what exactly constitutes maintenance of effort. It's just a number. We never have tied it to anything, any strategy, any intervention that's supposed to provide outcomes. It's just a number of dollars. I think this would be an amazing thing for us to do, and it would answer a lot of questions. So,
If I could just make 2 points. One, I think the MOU that's executed between MCPS and HHS around Kennedy Cluster is absolutely fantastic.
absolutely.
And it sets the blueprint for sharing of information, for collaborations. I have always maintained that that MOU should guide all the other pieces of work that HHS does with MCPS, and it's now is a direct, and that to me is one of the most tangible. I have to say, the staff have worked incredibly hard. The partnership with the state's attorney, you know, the MCPS lead coordinator and our lead coordinator both done an extraordinary job with very limited resources, and there's a staff person in there. The multi-A actually works to wrap services around their individual success stories, but that's all they are. There is not a comprehensive evaluation. The only other point I wanted to make, and to close that out, we're going to continue to do everything we can to get that MOU as sort of the lead MOU with which we lead our partnerships, because it really lays out. There was a lot of thought between our two attorneys to sort through information sharing, confidentiality, privacy, how to work with families, kind of stuff. So it's a very good product there that can be used for greater good. The only other point I would make is Gabe and I have had conversations with Chuck, and there is definitely more thinking around what could happen.
I mean,
Clearly,
we have this innovation officer. It just occurred to me, right? So,
Right.
you know, so we have this innovation officer.
We could bring him into the
these,
space,
These are the
yeah.
types of, these are the innovative kinds of efforts that we should be focusing on. And so I don't know. We have different things happening in different places, but I don't see things connecting.
there
I
is
don't see us putting anything and moving anything to scale. I just see us continuing to put, little pieces here and there. So I'm just interested in understanding how are we connecting everything, and also how are we going to scale.
Right. And I think that's the planning that's envisioned with this funding. And there is a leadership meeting coming up in June. So I'm hopeful that we can put these issues on the table and figure out how best to use this consultant that is being funded to sort of build that blueprint and then actually take steps to fund it.
So the 29,093 comes under maintenance of effort. The
Yes.
MCPS operating budget includes that.
Currently, yes.
That bears some thought. Yeah.
I think Councilmember Leventhal is right about this, bears some thought. I know there's a meeting coming up with the leadership team. I really don't know if we want to go ahead and fund another body, another person, to do the same thing that we've already seen done for 5 years in a row. I also think we need a completely brand-new proposal, because we are not in the same place we were in '07 that we are today. And in '07, it was my first year on the council, and I remember it was very difficult to get this proposal passed through this council because nobody really understood what it was going to do. And even today, my colleagues are saying, well, what's it all about? And so I think we're going to have to step back and reevaluate what we're doing here and what the purpose is going to be moving forward. I'm not real sure I'm ready to support funding something at this point. I don't know. I just am not feeling real excited about what I'm seeing here because it's just more of the same. So that's just my own perspective, and I know that Council Member Andrews has his light on if you want to call on him.
Mr. Andrews?
I would have my light on if the light lit, but it doesn't light. The light's not lit. No, I haven't had it on for hours. No. No. I agree. It's at least premature to expand a program that isn't documented at this point in a comprehensive way to be effective. And I think that this is the time to step back and look at the model, look at whether it needs to be reshaped. I do not think it's a good idea to spend $80,000 to engage a consultant to look at developing a plan to expand it to other clusters before it's well evaluated in the Kennedy cluster and any changes to it are agreed on. So I very much agree with what Councilmember Irvin just said in that regard.
Can I just say one thing? And for the record, Guy Balbenhorst, Director of the Recreation Department. Madam Chair, I agree with you. And I think that the description that you guys have before you does not clearly articulate what Chuck shared with you guys privately in meetings. And I'd like to propose that we take another crack at better describing what is in that vision, because the description before you does fall short of where I think we'd like to go with this. And you're right that it is, in the grand scheme of things, a drop in the bucket. But the connecting of dots that you guys all talked about takes some real heavy lifting. And there isn't any one specific agency or staff member that's in a solid position to pull those pieces together. And so I think the vision was that this person would help, working with everybody, do just that. So if you would like, I think we can go back and reword to better reflect the vision that was articulated to you privately.
So I guess my overall question here is, if the school system thinks that this is so successful, and if the commitment, and if the school system benefits from rising test scores, improved outcomes, why is so little of this funded in the school system?
I wasn't here at the initiation of the Kennedy Cluster project in this particular role, but certainly I think two things that are happening that will help us, and then I'll try to respond to your question. There are changes in FERPA which allow school systems to more easily share school system data with other agencies, and actually tomorrow, again, in working with Child Welfare and the Casey Foundation, we're going to have a joint presentation tomorrow and about those changes in FERPA and how school system policy will change based on that legislation, which was signed by the President in January. The second thing that we've done, again in collaboration with the Child Welfare people and with Kate and her team, is in working with the Casey Foundation, one of the things we're trying to do is, as I mentioned earlier, a study of linkages to learning. And looking at, we will have to look at some soft, somewhat is often seen as softer data, but they are helping us work through what data is most critical and how do you attribute a rise in student test scores to one particular thing when you have so many things that are
you don't need to
impacting the
attribute it. You
family.
just need to identify whether the students who are participants had rising test scores. Unless I missed it, that's not in the packet.
Well, it's,
I mean,
that
maybe
is,
maybe there's multiple causes.
Yeah.
Maybe the weather was better. Maybe they had, they ate more vitamins. I mean, all kinds of things could be there, but you know who the participants are and you know what their test scores are.
and those are the challenges that the Casey Foundation is working with us to kind of help work through. What are those key factors that you can pull out in terms of identification?
And I do want to also,
But I'm
I do
sorry,
also want.
is there some privacy restriction? Is that the FERPA issue? You're not allowed to track
No,
academic achievement? You can mask their identities.
no,
I mean,
it's-
I understand that correlation and causation are not the same, but you have a universe of students who have been in the program for some years that are in the Kennedy cluster, and you know what their grades are and you know what their test scores are.
But they're
We
really-
don't need to know their names. We don't need to know their home addresses.
There isn't really a program. I think that's what Councilmember Urban and
So you
President
cannot
Navarro
identify
were
a discrete
saying.
universe of students who tangibly benefit from this.
You-
It's more,
Yes, well,
you benefit.
Can,
there are two levels. Those children and families who participate in the multi-agency teaming, which is really the most fertile part of the Kennedy cluster.
How are their grades?
Some of them are improving.
Do we have data?
We have to get it for you. We did
Why
it.
wouldn't we report that for this discussion? How are they doing in school? It's such an obvious question.
Right, and some we've gotten reports related to their attendance. We need to get what their academic situation is. But I also need to point out that the children and families who come to the Kennedy cluster are the most struggling families. These are families who have had challenges in every area, where they've gone through every process in MCPS, and we have not
I
been
feel
able
like
to find
information's being
solution.
withheld. Yeah.
My recollection way back when we were having these meetings was that we were not only going to measure, obviously academic achievement was the ultimate goal, but that each agency would develop a set of goals too and targets and benchmarks, because the idea was that as we're moving towards this particular goal, HHS, the police department, everybody had internal goals. So we haven't had any data on that either?
So if I might, I think I just want to step back for 1 second to answer a question that you had, George. How did it not end up in the school system, which was your first question a few minutes ago? And I remember this was my second week on the job when Valerie, Nancy, and Dr. Weiss came over, and they came to us and said, and this has never happened. I use this story all the time because in my entire career it's never happened, where the public school system actually came in and said, HHS, you're responsible for all these other things, that would help stabilize the lives of these children and support their education achievement. Will you partner? And I have to say that to me is still sort of a guiding moment, right? So I tell that story all the time because I have worked in so many jurisdictions and the school system rarely participates in quite the same way. You were school board president then, you were still HHS committee chair, and Dr. Weiss. And out of that was birthed the Kennedy. There was Mr. Leggett was involved and Chuck Short was involved and all of us, and we created this Kennedy cluster concept, which had sort of, like you said, the Harlem Children's Zone kind of framework. And ultimately the recession hit, the ideas kind of stayed, we couldn't grow it. And we didn't fund it for evaluation. What was funded, and the only part of this program, there was a wonderful MOU, but the part of this program that's been really robust to date is the multi-agency teaming. And the teaming is a very child and family specific, multi-systemic coming together. The state's attorney finds this incredibly valuable. Every time we have positive youth development conversations, when they're at the table, that's what they speak about, how good it has been. So the academic, I'm agreeing with you that the evaluation is short. What I'm trying to share with you is so much of the energy, the limited staff that we've had, so much of the energy has gone into running the staffing.
How much would it cost
So,
to identify the students who have participated in the program and find out what their report cards say. How much would that cost?
I believe Kate said we'll take care of it, so we'll do that and we'll get back to you. There's 80-some students in this, in the pilot. We'll get back to you with that data, very specifically.
Isn't that something the school system should be doing?
Yeah.
Thanks. I just wanted to follow up on the need for that point, better data. And I also wanted to ask for more data on the teen pregnancy trends, because we have 2 years, and you can't tell a trend with 2 years of data. And actually, from 2010 to 2011, there was a good change in terms of a reduction in teen pregnancy rates. But again, you don't know if that's a trend or a blip. So at least we need to go back further than 2010 and look at 2007 and 8 and 9 to have more comparison, and hopefully 2012 would be available by now, because there hasn't been a birth in 2012 for 115 days now. So what's the how quickly can you turn around that data? I mean, how long does it take to get this kind of data from the end of a year into the next year? Is it available now, or is it not available for several more months because of where you need to get it?
Yeah, let's get back to you. I don't know the people. I'm not the expert, so I can get back to you on 12 data, but we can at least try to go back as far back as we can to pull a trend analysis. That's more than 2 years for you.
Okay, but also, how long? When is the data available for the previous year? Is the other question.
Okay.
Thank you.
Okay.
I just wanted to follow up on something that Councilmember Leventhal said, because I really think he's on to something about MOE and how we approach it moving forward into the next 90-day session in Annapolis, and that is we have all of these out-of-school programs that directly relate to how well students do inside the classroom, and shouldn't that be covered in the MOE? And I think that you're on to something, and I think that we need to bring this to our shared lobbyist with the county executive to see what we can do.
And could I just I appreciate that. I'd love to work on that. And I wouldn't even mind, spending above. I'm not trying to bump out existing MCPS programs. It just seems to me that we ought to be given some credit, and then that might make for a less contentious discussion.
Absolutely.
When we talk about spending above a constrained MOE. I'm not saying that HHS spending ought to be under an existing cap and then displace existing MCPS spending. I'm not proposing that, so people shouldn't get scared.
Right. We're not trying to supplant anything.
Right.
We want to add on top of it.
Yeah.
And so I think that this is a really good segue into why we need data moving forward into January. In the next 90-day legislative session, maybe we can do some serious lobbying among our colleagues in the legislature moving forward about this conversation, because across the state, we're not the only county complaining about the stringent MOE law and how it impacts county spending and the county budget. But I think that that we're on to something here that we need to sort of
From where I
work
sit, a
on.
primary concern, I've raised it a lot as chairman of HHS, is a primary factor for me that leads me, is MOE a floor or a ceiling? We'll just debate that endlessly. It's neither. I mean, it's a mandate. It's neither a floor nor a ceiling. You got to meet this level. And if you can go above it, you go above it, and then you get readjusted, and then you got to meet a higher number the next year. It's neither a floor nor a ceiling. And we'll decide from year to year what we're able to do, but most of us here are not inclined to spend above it. So you could say, well, therefore it's a ceiling, but we're not saying it's a ceiling, it's a mandate.
It's a mandate.
Right. So if we spend more this year, we got to spend more next year and the year after that and forever. Okay? Well, I might be less worried about that if I knew that it didn't cut into programs that affect children and families that I have to fund out of our committee has to fund out of the HHS budget.
Which is going to be constricted
Yeah.
if we go over.
Right.
So,
Okay. So is that all for the Kennedy cluster?
Well-
so is there a recommendation? The recommendation was to fund these
We were making critical and skeptical comments. Are we actually going to take the funds out that are recommended in the executive's budget? I mean, I'll follow the guidance of the authors of the program.
Wouldn't fund the consultant at this point. That's $80,000.
I'm not sure we need to fund the consultant now. I
Right.
think we need to regroup.
Wow, will that be the first savings we've identified? So
Hey,
the
we-
council president has $80,000 on the reconciliation list.
Hey, yesterday Geo identified another area as a wash, so hey, we're moving forward
So
here.
now we're up to like 150,000 or something. Ooh, making progress. We're about 15 million, right? Yeah, right, yeah. Okay. Okay, so is that it then? We wouldn't do the 80,000 for the consultant? Is that the joint committee's recommendation? And that's it for the Kennedy cluster, yes? Yeah, it was a good discussion. All right, so the next item is...
Guys, sorry, I should have mentioned before, it's my fault. Embedded within the 80,000 and using the MOU framework that Uma so articulately described earlier as one of the big wins out of the Kennedy cluster, as we look at expanding Excel Beyond the Bell and all of our out-of-school time programs with the school system, we want to make sure that the administrative infrastructure is in place so that it can work. And we have been working closely with the school system, and they've been doing, I have to say, an outstanding job in collaborating with us on a number of different levels. But once again, this is one of those situations where this is a lot of heavy lifting, and you guys have heard me say before, we've lost a significant percentage of our staff, and we just don't have anybody who has the dedicated time or the expertise to really move these pieces. And so part of the
Gabe, come on,
80,000...
This is a collaboration council function. This isn't adding to your staff.
The money would go to the collaboration council.
Right, so it doesn't add to
But
your
it would,
staff.
no, not our staff, but I'm saying the work that's out there that needs to be accomplished and done would be done by a consultant that would be housed in the collaboration council. But one of the reasons why we added the 30,000 to the overarching 80,000 was because we thought maybe this one consultant that would be hired, since they'll be talking to many of the same people, addressing many of the same issues, could do both things. So that
So how much would it cost
30,000.
just to develop a model to expand Excel Beyond the Bell?
We had estimated it at $30,000 to hire a consultant to help us do that work.
What's the sense of the committee?
So if we allocate $30,000, that's not necessarily for the Kennedy cluster.
Correct. That would be...
It's for the broader
Yes.
Excel Beyond the Bell.
The broader out-of-school time model and making sure that the administrative infrastructure is in place to expand Excel and other out-of-school time.
But we're not adding your staff. You're hiring a
No,
consultant to tell you
correct.
how you would have to add to your staff in the future.
No. No, there are a number of policy issues that have to be addressed in order for us to make this program work.
Give us an example.
Things like, so if a student acts up during our program and on one of our field trips during out-of-school time, do the school system's policies take into effect, and are they then punished during the school day if the program is happening during our time? So there are...
You need a consultant to advise you on that?
Well, there are legal aspects of this, and there's also, we want to make sure, again, using the Kennedy Cluster framework, that we have strong collaboration so that we can track information moving forward and provide you guys with the data that you correctly are seeking. And that doesn't just happen. I mean, we have to make sure that the policies are in place, and that's why we wanted to hire a consultant to help us in that effort. Not hire new staff, not to add additional programming. There's just an administrative base that's critical to making sure that these programs are successful and that it cuts across all out-of-school time programs, not just exclusively our programs. Because we really want to be strategic about this moving forward so that we're not just throwing money at programs that sound great, but that there really is a broad framework in place to make it work.
What does Nancy Navarro want?
That's fine. I mean, I'm a little bit concerned that, oh, sorry.
I mean, I'm asking...
I was just a little confused because I thought this was for the Kennedy Cluster project, but then it seems like it's broader. It seems like it's for out of school time, which means that then it's a collaboration council thing, so it should have come in a different, anyway. But, I mean,
Put it out there, Madam
$30,000.
President. We'll follow your lead. What do you want to do?
Sure,
you
let's
did
give you the
express it.
$30,000.
She needed that.
Let's give you the
Gotta have
$30,000
the
for
30.
that consultant so that you
All
can
right, so
have
bring
a
the 30
blueprint.
back. Okay, but the 50 for expanding Kennedy Cluster, we're not going to do until we have a better sense of what the
Until
Kennedy
we have a
Cluster
better sense
has
of-
the effect that we
yeah.
hope it would have.
Yeah.
So until you can make a case that for expanding it, we're not going to hire a consultant to tell us to expand it. Right? Is that the sense of the committee?
All right.
Okay. All right, so that's that for Kennedy Cluster. So we're going to close out with child and adolescent